Apologies, guys. Apologies for that. All right, guys. Again, I'm so sorry about that. I'm new to YouTube, obviously, and this whole live stream thing. I had it selected as only for kids, like our kid-friendly audience, and it restricted the comment section. And I wanted to make sure that you guys obviously are able to participate in the chat and whatnot. So over time, I'm going to have a built-in YouTube thing where the Pomodoro is going to be on screen for you guys, and we're going to be able to go through cycles like that. But just for now, I'm going to start a manual Pomodoro. How I want these really run is I'm going to do 4 sessions of Pomodoro. So we're going to do 30 minutes on, 5 minutes off. During that 5-minute time, that's when I'll engage and interact with you guys. So I'll take a look at the chat. We can talk any high-yield USMLE concepts. We can, any Q&As you guys have regarding med school or your studies or how to study or anything like that. I also have my guides here if you guys have any questions about those. We can definitely talk about those in my pocket guide as well. And yeah, that's how basically things are going to run. At the very end as well, I'm going to be asking a question for my guide and we're going to be doing a giveaway. So I'm going to set this up now and we are going to do a Pomodoro. So first, guys, in the chat box, what is everyone up to tonight? What are people studying? What are people doing this week? How is school going? How is all of that going? Awesome. I'm going to actually create a poll. I'll say, where is everyone from? Awesome. Next semester starts Monday, Osmar. Cool. Deshaun, last semester of basic sciences. That's exciting. Pre-nursing student studying for AP2. Awesome. Love to see the diversity in here. I know that there's, both pre-meds, med students, PAs, nursing students, master students all in this. So love that I have such a great community going here. School's going great, I guess. That's a very hesitant, I guess, mate. We're going to start the Pomodoro in just a second. Essentially, how this is going to run moving forward, though, I was telling people as they came in, I'm going to have a Pomodoro clock on screen for you guys. Right now, it's vertical. This is my first YouTube Study With Me session, so forgive me for a bit of the technicality issues. But we're going to have a Pomodoro on screen so you guys can also work alongside the pace and see the timer. But for today, I'll just have the timer notify you guys when that's done. During the breaks, I'm going to have an opportunity for you guys to ask any questions. You guys can ask any questions about my guides. We can talk about USMLE. We can talk about some concepts you guys are struggling with, if I can help explain any of those. We can talk about how to study, how I stay focused, anything, med school questions, anything you guys want. And then at the very end, we are going to be doing a giveaway. I'm going to be giving away some of my guides to you guys. Awesome. All right, let's do this though. So I was just trying to see if I can do a timer, but I'm gonna just put the timer in right now. So the 30 minutes, we'll do 25 rounds. So 25-minute round starts now. I have a Pomodoro clock going, so I will notify you guys when that's done. Let's do our first session, guys. Focus in 25 minutes wherever you guys are studying, whatever you guys are doing. Maybe you're not studying, maybe you're just getting other work done, but let's really just try to focus in on the task right now. And then we're gonna have a 5-minute opportunity. I'm gonna talk to you guys. I'm gonna look at the chat. We're gonna answer some questions. All right, guys? All right, timer is starting. I'm right now doing UWorld review, by the way. I'm doing some USMLE UWorld review. I love this mnemonic, guys. I used it for the MCAT as well. The snowdrop mnemonic for the electrophoresis, the blotting techniques. I had a question on it on UWorld. That mnemonic never fails. So, DNA, yeah. So protein's got to be an antibody. So C-June, let's see, Foss. Polyhydramnios. I actually have a nice little mnemonic in my book about this one. Treatise, that's definitely probably. Here's a nice little tie-in quickly, guys. If you guys are studying for the USMLE or in your med school exams, two really important complications of both impetigo and group B strep. So rheumatic fever, classically group A strep and impetigo, those can cause two things. They can either cause rheumatic fever or post-streptoglomerulococcus disease. So you guys have to be really aware for that. If it ever says like they have a throat infection 2 to 3 weeks prior and now they develop kidney problems, you're thinking post-streptococcal glomerulonephritis. So impetigo and group A strep pharyngitis. Really important sequelae there, guys. Rheumatic fever and PSGM. Yeah, erythema nodosum too. Yep, good point. And then there's all the different erythemas, right? Erythema marginatum, classically the target sign after a herpes simplex virus or mycoplasma. Nodosum, as you mentioned. If you see nodosum, always order a chest x-ray. You could be thinking one of these. You could also be thinking sarcoidosis. Bilateral hilar lymphadenopathy. What's another infection that can lead to ascending paralysis in the peripheral nervous system? It's a demyelinating peripheral disorder. Put it in the chat if you know. Yep. Nice job, Roberto. Campylobacter jejuni, ascending paralysis, peripheral nervous system. You're going to have elevated protein in the CSF. What criteria do we use for rheumatic fever? Yeah, Guillain-Barré syndrome. Yep, good job, guys. Hypersensitivity reactions. Yeah, good job. The Jones criteria, right? Joints. The O is for a heart, carditis. Nodosum, Sydenham chorea, right? And erythema. Yeah, really good job, guys. The other thing, guys, is hypersensitivity reactions. Does anyone know the hallmark features of the 4? And give an example of each as well. I'll give you guys a hint for the hypersensitivities. I love the mnemonic acid. Allergy, complement, immune complex, delayed. Let's do a couple examples. Again, A for acid, in the acid mnemonic, allergy, anaphylaxis. Type 1 hypersensitivity, mast cell degranulation. You're going to get swelling, the vasodilation, right? The histamine, bradykinin, all those inflammatory mediators are going to rush to the site. Type 2, cytotoxic complement. Okay, you're thinking good pastures. You're thinking autoimmune hemolytic syndrome, right? Type 3, you're now actually thinking about immune complex formation, so IgG, right, and IgM. Classically, we just spoke about it in post-streptococcal glomerulonephritis, and this is a great tie-in, guys, on electron microscopy, right? You're gonna get the hypercellular glomeruli because these complexes are going to deposit in the mesangium. And then finally, type 4 for delayed, right? Contact dermatitis, right? Your TB prick test, right? You need essentially there's 2 reactions. You become sensitized in the first, right? Helper T cell sensitized, and then the second time you're reactivated, and it's a much quicker response. Anyone have a fun way to remember the difference of mechanism of action between benzodiazepines versus barbiturates? Because I have one. I'll share it with you guys, but I want to see if any of you guys know of a fun one to remember. All right, if no one has one, barbiturates, you're going to think barbiturates, duration, okay, because it opens the duration that the chloride channels open on the GABA, GABA A, right? These are our main inhibitory neurotransmitter. They're going to increase duration, barbiturates, duration. Benzodiazepines are then frequency of the channel. That's going to be your GABA A. They're going to allosterically activate that. GABA B, you're thinking baclofen. B for baclofen, commonly used to decrease spasticity in conditions like cerebral palsy and whatnot. Yeah, exactly. And this is barbiturates, duration of chloride, right? GABA A. But that's the way, and then the other ones. Great. Good job, Mubina. These both barbiturates and benzodiazepines is going to be your GABA A subtype. GABA B, remember B for baclofen. Baclofen, okay? We're going to start the break in 2 minutes, guys. If you guys want to start putting your questions in the chat, if you guys have any questions about any topics, concepts, studying, my guides, anything, let me know. Okay. So I'm starting the break timer, guys. I'm going to answer some questions here. Can you explain the dynamic lung function tests used today? Okay, well, I'd say the most common one is probably spirometry. I'm not sure if that's what you're talking about. Essentially, guys, in spirometry, there's two really important values. Your FEV1 and your FVC. Does anyone know what those are? Okay, I'm just going to talk about them then. So FVC stands for forced vital capacity. FEV1 is essentially the maximum amount of air you can expel in the first second. FEV1, 1 second. Okay, guys. So essentially, when we administer spirometry to a patient and we calculate these two values, they give us a lot of insight into whether the pathology may be something called obstructive, like in a COPD or an asthma, or something like a restrictive problem, okay? In an obstructive problem, there's too much air trapping, okay? Commonly patients will have an increased AP diameter, like think about the classic COPD patient. They have problems getting air out, okay? If your FEV1 then, if I try to exhale as much as I can in the first second on spirometry, right? I'm going to, in someone with COPD, they have problems getting air out, okay? Due to pressure gradients, right? There's too much air trapping in their alveoli. And so what happens is you're gonna get a reduced FEV1 greater than the FVC. And so usually you're going to have a FEV1 FEVC ratio less than 0.7. So 0.7, guys, is the key number to keep in mind. Now, if this ratio is normal or even a little bit higher, that's because our FVC is severely compromised in something like restrictive problem, right? If we have two numbers, FEV1 and FVC, denominator. If you decrease this denominator, right, the ratio goes up. In restrictive problems, you have a very much restricted force vital capacity. In restricted, I like to think there's not necessarily a big difference in expiration or inspiration, like one or the other. It's just everything is just shrunken in. So imagine restrictive, just like everything is compressed more, and think of it that way. That helps me at least. Whereas in an obstructive pathology, right, you have more problems getting it out because there's air trapping. Yeah. So FEV1 FVC ratio is key, guys, and 0.7 is the number you're looking for. So I hope that answers that. For organizing notes, guys, everyone has their own methods to do this. I'll say this. Be very intentional with the resources you use. There is hundreds of resources you can use. Find a style, whether it be videos, lectures, notes, textbooks. Find something that really works for you in terms of something that you enjoy studying from and that you find, you're receiving well. After that, instead of copying down things word for word to memorize them, guys, it's all about integration, okay? If you're learning a concept, right? If you just learned, let's say, about the cell cycle, right? You just tirelessly copying it over and over is not going to really help you in a lot of ways because A, it doesn't improve your understanding. You're just copying it verbatim. And B, you're not actively testing your understanding of it. And so I'd say when you learn something, right, stick it into some flashcards if you want to build that long-term retention, okay? And then, as I said, always do practice questions to test your understanding. That's how you're going to integrate these concepts and actually understand what you're learning. In terms of what you said though about annotating your notes, yeah, like just focus on the key concepts. That's a really good point. So yeah, focusing on key concepts is a big thing. And you'll learn as you continue to study, as you continue to do exams and tests, you learn what's high yield, what is information that you will need to be, will be tested on and whatnot. And so those are things that you kind of just develop over time. I'd say, look at, if you're, in a class, look at the syllabus, for instance, and look at previous exams, previous tests, see what concepts they're really trying to test on and focus on those. Don't just highlight everything. Don't just copy everything down again. Make connections. If you learn the cell cycle, well, now maybe let's learn proto-oncogenes and what regulates the cell cycle and how that plays into it, and what diseases now may affect the cell cycle. And I'm classically thinking about the lymphomas, like the BCL2 cell cycle mediator, right? For instance, with follicular lymphoma. So it's like if I learn the cell cycle, but now I'm incorporating BCL2 and follicular lymphoma, now everything's connecting. So that's how I like to learn. Yeah, Pika, ICA, and ASA. So Mubina, I actually cover brainstem stroke localization really well in my guide. I have a whole page on the rule of fours. If you guys haven't learned about the rule of fours, it's such a key concept to get your head around. Essentially, guys, when you're thinking neuro, when you're thinking brainstem, when you're thinking strokes, always think rule of fours. What are the rule of fours? The rule of fours is 4 cranial nerves arise from above the pons, 4 from the pons, and 4 below the pons. That's the first thing you need to know. So 4 cranial nerves come from the midbrain, pons, and medulla. Okay? The second thing you need to know is that all the medial structures, okay, are going to start with an M. Medial lemniscus, motor pathway, motor cranial nuclei. Okay, all the M's are midline. Then you're going to learn that and there's 4 paths, and then the 4 side structures all start with an S, right? Spinal thalamic, spinal cerebellar, etc., right? So first you have to get that anatomy down. 4, 4, 4, 4 medial with M, 4 side with S, okay? Then you're gonna have to learn the circle of Willis, okay? And that's where it's a little bit of memorization. So you're gonna have to know, for instance, that as you mentioned, the ASA is going to be your medial medullary syndrome, right? And then your PICA is your lateral medullary syndrome and whatnot. But essentially, guys, Where is this? Essentially, you got to get your head around the rule of fours. Once you get your head around the rule of fours, then it's just plugging in which essentially, vessel from the circle of Willis is affected. There's a little fun memory trick. Pika-chew. So Pika, they're likely going to have problems with chewing. Okay? It affects your hypoglossal and your all those nerves. Then for Ica, I like to think of Ica almost looks like facial. You can put the word facial in Ica, Facial, right? Because you have problems with muscles of facial expression because it affects cranial nerve 7. So those are 2 little tricks that I've used. Anyways, guys, I'm going to start up this Pomodoro again. Um, 25-minute round. Here, so Pika. I like thinking of it as Pikachu. And then I like to think of it as facial. So those are 2 ways that I like to remember the brainstem strokes, Mubina. But the rule of fours is key. 4 cranial nerves above the pons, 4 at the pons, 4 below the pons, 4 medial structures, starting with M for side. Those are my tricks. Again, I have a really nice page, Mubina, in this guide. I don't know if you have the neurology guide yet, but I have a whole page on the rule of fours and brainstem stroke localization. All right, guys, I'm starting up this 25-minute. All right, guys, lock in another 25 minutes. Falcibrium. So 24 all Vivax Valley is going to be 48, and they remain dormant reticulocytes, and old for malaria. Instead of oral. Put in the chat if you guys know why. Or if we, so rectal, IV, sublingual, all of those methods. Essentially, guys, first pass metabolism, right? Your liver is the primary kind of haven for metabolism of most medications and most drugs. IV directly into the blood, sublingual or rectal, commonly can, what they call is bypass this first pass metabolism to increase the concentration and bioavailability of the medication. All right, guys, Crohn's disease and ulcerative colitis. Really high yield. Anyone want to break down the major differences between Crohn's disease and ulcerative colitis? I have a fun mnemonic for this one too. Yep, really good. Yeah, guys, really good. So I have a little fun way to remember those features too. Crohn's, one word. Ulcerative colitis, two words. So Crohn's, one word. Th1 mediated. You skip on one leg, so skip lesions, right? Full thickness, so entire thickness, one wall thickness, you get the fistulas, right? It affects one spot at a time. You get that string of beads appearance, and you get the cobblestone appearance. Ulcerative colitis, two words. Th2 mediated, right? Mucus comes from the two nares. It is mucosal. It only affects partially of the wall, right? And then lead pipe, two words. Lead pipe is the classic manifestation. Yeah, exactly. UC is limited to the colon. Yep, exactly, guys. And then I like to remember that 1 versus 2. It's a silly way, but Crohn's, one word, Th1, right? You skip on one leg, skip lesions, right? One full wall, right? Full thickness, transmural fistulas. String, right? String appearance and cobblestoning. Ulcerative colitis, two words. Th2, two nares. Two nares, mucosal. It only affects the mucosa and submucosa. Ulceration, right? Always, guys, always don't forget the feared complication, toxic megacolon, right? And exactly. Crohn's can appear from mouth to anus, and ulcerative colitis is going to be limited to the colon. And that's pretty self-explanatory, right? Colitis, colon, right? Ulcerative colitis, colon. Other thing, guys, is Crohn's disease often affects the terminal ileum. Now let's do some tying in. What is really important that happens at the terminal ileum? Hint, a B vitamin is absorbed here, alongside something that is released from the parietal cells. Anyone want to tell me about Crohn's disease and terminal ileum? Hint, pernicious anemia. Yep. Really good job, Mubina. Vitamin B12 is going to be absorbed in the terminal ileum. Okay. So in things like pernicious anemia, right, where you get autoimmune destruction of the parietal cells, right? Remember, our parietal cells not only secrete our HCl, or acid, but they also secrete what? Intrinsic factor. Intrinsic factor binds our B12 so that it can transport all the way down to our terminal ileum where it's absorbed. Guys, first question is, what artery in the circle of Willis commonly will affect speech? So if you get a stroke of which artery, you can get things like Broca's aphasia and Wernicke's aphasia. What artery is going to supply those areas? Is it the ACA, MCA, PCA? Yep, all you guys got it, MCA. The Stroke Man, guys, I love the Stroke Man. I don't know if I have it. I think I do actually have it in here. Really good job, guys. A little sneak peek from my book. Okay, if you look at this man here, if you look at this man, right? ACA is going to affect your lower limbs, right? Let's circle back to our homunculus. ACA is going to have contralateral hemiparesis and sensory loss in the lower limbs. You're going to draw an A for the lower limbs. Your MCA is going to classically affect your upper body and your mouth. So M for mouth. Broca's aphasia, guys. BA is going to stand for broken articulation. That's how you're going to remember that. And for Wernicke's, you're going to think of word salad, where they're just rambling and it doesn't make sense. When repetition is affected, guys, you're going to be thinking a conduction aphasia, okay, affecting the arcuate fasciculus. And finally, guys, PCA, you're going to draw two eyes here, okay, for PCA, because you get that classic contralateral hemiparesis with macular sparing, because the MCA supplies the macula. So even if you have a PCA stroke, you're going to have the macular sparing. That's for my neurology guide, by the way, guys. And how about this, guys? You can get an MCA stroke in the dominant versus the non-dominant hemisphere. Okay? Does anyone know if you have an MCA stroke in the dominant versus non-dominant hemisphere, what that can present with? Yeah. Roberto, really good. Dominant is usually your left hemisphere, and you're going to classically get the language deficits like we talked about, the aphasias. Your non-dominant, does anyone know about that one? So usually your right side, you're going to get that contralateral hemi-neglect. Spatial awareness, right, is going to be affected. Yeah, agraphia, yeah, that's really good. Yeah, good job, guys. All right, guys, put your questions, topics, comments, anything in the chat in 2 minutes. We are going to do our second break. So anything you guys, any questions you guys have, I'll answer. All right, guys, I see some above here. So how long did it take to make these guides? So I showed you this guide here. I just used this one for my stroke man. But essentially, guys, I'd say that these take me a few months each to do. The OSCE guide, again, guys, really nice for your clinicals. So it has all of the tabs here for the different exams you need to know. Right, guys? So let's say you want to, look at the GIT exam. You just flip it over. And then on the back side of each page, we have specifics for the examination. All of my products, guys, if you guys want to check them out, are available on my website. So check them out there. Yeah, OSCEs are a little bit nerve-wracking, but the key thing, guys, for your clinicals is to practice. You're studying. You can study all the preclinical, all of the theory, all of the physiology, the anatomy, the pathology, but when it comes to OSCEs, guys, when it comes to examining a patient, when it comes to going through differentials in your head based on signs and symptoms, those are things you got to practice. So do simulations. Use my OSCE guide, and make sure to just practice over and over to develop those skills. Let's talk about another trick that I love that's in my cardio guide. Does anyone know how to differentiate between, or the classic features of pressure overload in the heart versus volume overload in the heart? Okay, there's a couple key differences. Okay, well, I like to use this mnemonic, guys. S3 and S4 heart sounds, right? These are abnormal. S3, heart failure, 3 syllables. Classically, you're going to get heart failure in what? A dilated cardiomyopathy, when it's kind of a ballooning ventricle, right? Very thin walls, okay? Classically, that's when your sarcomeres are going to be added in series, right? Eccentric series. Classically, in a lot of the regurgitations, volume overload, incompetent valves, right? You get backflow into the ventricle. That's going to cause dilation. It's going to cause eccentric. It's going to cause heart failure. Heart failure, S3 sound. To contrast that, guys, S4, hypertension, 4 syllables. Hypertrophy, right? Hypertension, great. And that's going to present with the opposite. So what are we going to get? You're going to get concentric thickening of the muscle, right? Added in parallel, okay? They're going to be added in stacks. Classically, in our stenotic diseases like aortic stenosis or chronic hypertension, like I just said. Yeah. 3, heart failure. Yeah, good job, guys. Yeah, guys, I'm going to be making guides for every specialty. So we have cardiology, complete guide to cardiology out, complete guide to neurology, and the OSCE guide out right now. We do have a back to sale bundle going on right now, guys. If you get multiple copies, you guys get up to 20% off the bundle, which I really suggest if you guys need help with cardiology, neurology, you love the mnemonics, and you need help with your clinicals. All right, guys, we're going to start back up. But I do plan on doing one for every system. So next, we have gastrointestinal. We'll do endocrine, repro, heme, onc, immuno, all those. Yeah, so Fatwa, I really suggest you get the neurology guide, the cardiology guide, and the for USMLE Step 1. Again, guys, schoolbro.com. You can find my complete guide to cardiology and neurology. All right, guys, we're going to do another round. Let's focus in again. Hirschsprung's disease. Giveaway in 5 minutes, guys. Any last questions, put in the chat for me. Okay, guys. That's going to end the session. But before we end, we are going to be doing a giveaway. So what's going to happen, guys, is I'm going to pick a concept. I'm going to ask a question from my neurology guy. The first person to put the answer in the chat is going to win one of these guides, okay? Okay, guys, and just a reminder to anyone as well, if you do want to access this neurology guide, my OSCE guide, or cardiology guide, I will put in the website, my website. They're designed for med school. They're designed specifically for the USMLE Step 1. So comprehensive, essentially contains all the first aid concepts, just a lot more visual, the mnemonics, all the memory tricks that I use, everything in here. So that's the link there for USMLE study resources. And if you guys don't have my free USMLE study starter pack, you guys also need to get that. So this is the USMLE study starter pack. Okay? And that's free. All right, guys. I will be doing more of these. I'm going to develop a system where I can have the Pomodoro on screen so that we can work together. I'm also going to have a timer for how long the whole session is going to be, when the giveaway is going to happen, and make it a little bit more interactive for you guys. Again, I'm just starting with YouTube, so bear with me. I'm going to get more used to it and obviously cater to the platform as I figure it out. All right. Yes, guys, answer is going to be on the YouTube chat. So giveaway, get ready. First person to answer in the chat. First person to answer in the chat. Is going to get a copy, okay? All right. The question is, what cranial nerve palsy is classically associated with an uncle herniation? Okay, guys? What cranial nerve palsy is classically associated with an uncle herniation? First person I see in the chat will win this guy. Really good. Awesome, Alex. Yep. So Alex is the first person I saw here. If you guys want to see here, so I have a whole diagram, right, with the herniations and all the key findings here on the left-hand side. I'm just going to hold that up. Awesome job, guys. Again, thanks for all coming. I'm going to be making this a little bit better in terms of the technology, the Pomodoro clock on screen, all that good stuff. We're going to always be doing giveaways. I'm going to try to engage as much as I can with you guys as I go through my own USMLE prep, UWorld, all that good stuff. Again, guys, if you are studying for the USMLE or your med school exams, my neurology guide is out now. I highly recommend this. The cardiology guide has been out, and the OSCE guide is available too. If you get all of them, okay, or if you get multiple, you can actually save. We have a bundle and save feature for back to school right now, so you can save up to 20%. So go check it out on my website. Yeah, guys, I'll see you every Tuesday at this time. We're going to be doing it. All right, Alex, I'm going to be messaging you. Yes, so we're most likely going to be doing them on 7 p.m. on Tuesday EST, okay? Again, guys, if you guys are interested in any of the products or neurology, make sure to check it out on my website, okay? You guys can find them here. All right, guys, thanks again. Really enjoy this. Hope to see you all back next Tuesday for another great study session. That's it.